when you are left with 1 second, I will show you this one, and we need to stop if I show you the last paper. So with that information, the second presenter is Angelica Thomas Sotomane, and the topic is on investigation of case of serpiginous dermatitis in a paramilitary training institution in Mozambique. The floor is yours. Thank you.
Good morning to all the plenary. As the moderator already said, my name is Angelica Sotomani. I come from Mozambique. I'm FTP Advanced. In the next 5 minutes, I will show the findings of the investigation of case of serpiginous dermatitis in a paramilitary training institution. It's known as well in scientific field, cutaneous larva migrans, but in Mozambique is known culturally as tsukunyani. It's a parasitic zoonosis predominant in tropics as Mozambique, and it's caused by Ancylostoma caninum, and this frankly affect people who are in contact with contaminated soils, and until now there's no official records of this disease in Mozambique, although in 2021 there had a recurrent occurrence of suspected case of this disease in first-year trainees of paramilitary. As I said, in Mozambique we call tsukunyani, so the reason why the paramilitary even gave the name of Regiment Tsukunyani to those students. We can see that there is a pneumonic scar lesion. We can see that most of the students has this kind of lesion, and with the objective of prevent new cases, we did the investigation. The study design was a cohort retrospective investigation. As we can see in the map, this is the location of the paramilitary institution, and the population was all first-year trainees of 2021 and 2022. Stop. Is to stop?
From the translator, we are informed that there is a technical issue, so let's give them a few minutes until they, so we'll kindly ask you to start again, okay? Sorry. Can we start? Okay, can you start again?
All over again?
Yeah, sorry.
I will repeat again. I will greet again, and I will represent again. My name is Angelica Sotomani. I'm from Mozambique. I'm FTP Advanced student, graduated. I still think I'm a student, but I'm going to present the findings of the investigation I did as a student of case of serpiginous dermatitis in a paramilitary training institution. As I was saying, is scientifically known as well as cutaneous larva migrans, but in Mozambique is known as tsukunyani. The paramilitary institution even gave the name of the regiment as Companhia Tsukunyani in Portuguese. It is caused by Ancylostoma caninum, that is a parasite, and mostly affect people that are always in contact with contaminated soil. This contaminated soil is contaminated by cats and dog feces. There's no records in Mozambique, but the institution in 2021 notified the National Institute that they were having a recurrence of suspected case of this disease. We can see the pneumonic lesion in one of the first-year trainees, and with the objective of preventing new case on these trainees, we did a retrospective cohort investigation. We can see in the map, we can imagine a little bit where is the institution. The population was 2021 and 2022 trainees, and the case definition was for suspected case, those who had itching or irritation, and for discarded case, all those that had a story of dermatological condition. How the investigation was carried. To confirm the outbreak, we saw the health facility logs, that the health facility is inside the institution, and to identify the risk factor, we did a questionnaire. And we did to the environment investigation. And no laboratory diagnosis was needed because we already had the epidemiological fact. The variable of interest was demographic characteristics, behavior factors, and the environment characteristics. You can see an image of me doing one of the interview. For ethical consideration, all of them was apply consent. This is the flow chart of 2,066 trainees. Only 22 we wanted 100%, but only 92 consented. Most of them were male, and unfortunately most of them were suspected cases too that helped to our results. We did the storage in Microsoft Office, and we analyzed with Stata 66.1 to do the relative risk of the behavioral factors. The results, we found that in the logbooks, 73% of them were with the diagnosis, most of them being male. We saw that most cases were in 2021. We see a peak here in February, and we saw either that in the questionnaire, most of them was in the 18 to 24 years, being although 2 males. And most of the symptoms was the rash, was then the separational scar, erythema, and the last one was itching with linear irritation. We can see too that because of the exercise that they do, the buttock, legs, and arms were the region with most of the lesions. And the contact with dog feces, contact with cat feces, as you can see in red, and prolonged training in contact with damp ground we had 1.9, 1.6, and 1.6 more times than the others that didn't have this kind of contact. We see in the environment investigation, we saw 2 dogs, and we saw the garbage open that attract these kind of dogs. And in our investigation, we saw that this disease is a big concern among the first-year trainees, and we saw that, as in the literature already said, that most of the people with this disease is in frequently contact with the soil. And as conclusion, we confirmed the outbreak in the facility, and we recommended to disinfect the soil and strengthen the surveillance among the health center. And this is my knowledge, and this is the field team that is not here. Thank you.
Thank you very much for managing your time. The next presenter will be Maftali Zaftina from Madagascar. So he will tell us his topic, and he will proceed with his presentation.
Bonjour à tous. Je m'appelle
Good morning, I'm Mahfali, ATP Frontline, Madagascar. Ladies and gentlemen, it's a great pleasure for me to make this presentation on collective food poisoning in Madagascar, region of Menabe 2023. In the world, we project that 6 million people suffer from food poisoning, and several die. In Madagascar, collective food poisoning was noted in 2015 to 2019. In 2023 February, the reference hospital of Mientfas alerted us about 3 patients who had come from the same family with food poisoning. The it was noted that this needed investigation to determine the extent of the situation, determine the contributory factors, and put in place prevention and control measures. With these objectives, we carried out a descriptive study in Miantvas district with a population at 177,000 people. Women and children do cooking, families eat together, and they go through challenging times during the rainy season from March to July. We engaged the family members and neighbors of the suspected cases. We confirmed the medical records of the patients. We also had carried out a similar case within the community. The case definition comprised all people having conscious challenges, headaches. The results of the study show that 3 out of 7 members of every family were affected with a great attack of 100%. They had all eaten rice that had been cooked by a small boy of 13 years as breakfast the 10th February 2023. During the survey, neighbors pointed out that we had indigenous plants that are toxic, that resemble morel, which has the scientific name nicrom. 1 hour after the breakfast, the first symptomatic signs started appearing, as we can see on this graph. They had consciousness problems, dizziness, and we had those who had vomiting, and 33 others had fever. They were all hospitalized at the reference hospital center of Miantvas on the 10th of February 2023, and after treatment of 3 days, they all got healed and left the hospital on the 13th of February 2023. We noted that no similar case had been recorded. Unfortunately, our study has a limit because we were not able to find food samples for laboratory tests. In conclusion, due to the existence of the toxic plant, indigenous plant in the region, and noting that it was a boy of 13 years who had prepared the food, we can note that it was a collective food poisonous related to the use of this plant. As prevention measures, we sensitize the population on the existence of this indigenous poisonous plant in the community, and warned them against its consumption. As recommendations, we recommend to health actors, communities, and parents to enhance sensitization on the differentiation from the indigenous plants, those that are poisonous and the edible ones. On that, I come to the end of my presentation. Thank you.
Presentation. I think we'll go for our third presentation. Then we'll have a question and answer for the first 3 presenters. So do we have the next presenter, who is called Tognise from Benin. Do you have the presentation? Yeah, it's not in this one. They send me on Excel.
Bonjour. Moi, c'est Raoul.
I'm Raoul. I'm from Benin, a graduate of FTP. I'm honored this morning to make this presentation on the epidemiologic characteristics of acute flu from health centers to public hospitals from 1st April 2021 to October 2022. We can say, as we introduce, that malaria is a key problem for public health in the world. In 2027, WHO estimated that 3 billion plus people were exposed to the risk of contracting the disease. In 2021, in Africa, we noted 228 million cases with several deaths. It is very common among children of less than 5 years. This cases is a principal cause for admissions and death. In 2019 in Benin, malaria constituted the first causes of consultation and admission in hospitals for children of less than 5 years in a proportion of 49%. Our study allowed us to determine the characteristics of the referred cases of acute malaria among children of less than 5 years. This is a picture just to illustrate to you malaria among children through mosquito bites with symptoms such as fever, headache, nausea, and others. How did we go about the study? It is a cross-sectional study across a number of hospitals in various regions from February to October. A random selection of files was done and the data collected, and the analysis was done by APFO for proportion, and we have a representation by graphs and tables. Which are the hospitals that recorded these cases? It's a national study, so we are showing you here the map of the spread of hospitals in Benin, which were posting cases of acute malaria. With regard to the results, on the 100,000 cases, 29% were referred from health centers. You will note here that these are the hospitals at the spread of hospital cases that were referred. There are 2 departments or regions that had most referrals. These are the social-demographic distribution, and our boys were 1.1%. The cases of anemia were the most serious, and fatality. We noted that ambulances were used for a number of the cases, but most of them, which were 19%, were referred from small hospitals. 80% were admitted from public hospitals. More than half of these cases had received their pre-referral services. In conclusion, we can recommend that the capacity of service providers needs to be enhanced, on the issues of reference or referrals. Thank you.
For managing your time. So now it will be a question and answer session for the first three presentation. So I would kindly ask the presenters to come in front. The three presenters kindly come to the front. So we'll have a 10 minutes for question and answer. Try to make one question per participant. You can see it there. So, yeah. So, one, I will give you number. Two, Patrick. So you need to address 3, 4, 5. So in the first round, let us take these 5 questions and we'll see our time. Who is one? I think it's...
Bonjour tout le monde et merci.
Good morning, and thank you to the presenters for the quality of your presentations. This small question to the representative of Benin. You say that the ambulance was not really used. What are the main reasons? And in your recommendation, we are not seeing any action related to make some changes. I'm Patrick Mavunga from Central Africa. I had the question for Benin that has been asked by my friends. So I'll go to Mafali of Madagascar. This is a nice study, a nice survey, because you did not find the plant that caused the problem. You did not have a toxicology examination to be able to identify the black nightshade.
Sarah Albana from the U.S. And my question goes to the presenter from Mozambique. Your recommendation was to disinfect the soil. So can you talk a little bit about what that process is like, what resources are required, and if it has occurred?
Bonjour, merci, félicitations.
Good morning. Congratulations to the presenters. I'm Richard from Benin. I've got one question to Benin, but that was asked by someone else. I'll ask to Madagascar. In your study, we noticed that the main cause for intoxication, that you thought that it was a certain plant. So is it possible to work together with the environmental expert to be able to identify the cause? Thank you.
From Mozambique, since it was not translated. Yeah, that's your concern, yeah? Was it translated for you? Okay. Can you repeat the question for the presenter to Mozambique so that the translators can help her?
Okay, thank you. My question is, your recommendation was to disinfect the soil. So can you talk more about that process, what resources it requires, and if it has already been done, or if there are plans for it to be disinfected?
Let's proceed with the response according to how you see it. Proceed.
Ok, merci à tout le monde. Moi, je n'ai pas eu de questions pour le moment. Je vous remercie.
So I can only say thank you for the question raised to others to strengthen this study. Thank you.
Thank you, Sarah, for the question. I'm going to respond in Portuguese. The disinfection is through a preparation of 2.5% of sodium perchlorate, which is sprayed on the soil, and it has to be on the soil where you have seen some dogs, some cats, or some feces, or where the parliamentary do their trainings. They can also be used on the lakes. Thank you.
Merci pour les questions.
Thank you very much for these questions. The first one was about toxicology from plants. As we said it before, we were not able to identify the other plant, the remaining plants, and the other issue is we do not have a laboratory capable of doing capable of extracting toxins in the plant, so we don't have a lab. The second question, can you remind me the second one? Microphone, please. Microphone. Okay. In Madagascar, we have a system with health centers and specialists of animal health and environmental experts. Yet, maybe I did not quite get the question, but we do have environmental experts that we can work with. Or rather botanists.
Okay. Merci.
Thank you. Thank you for the interest on this study. You'd like to understand why the ambulance was not used. Yes, we do have ambulances working with hospitals, the district hospitals, and that can be deployed whenever there is a certain alert and a referral from the health center. But most of the time, our parents, when they are they are in a health center, they'll be able just to take a motorbike to rush the person to the hospital instead of calling upon the ambulance. So we did not put up a recommendation in this regard because we think that we should do further studies to understand why they prefer to use the motorbikes. So we will actually follow on that. Thank you.
Thank you very much for the active participation from the audience, and also we'd like to thank our presenters. So may I ask you to give them a round of applause for the first round of presenters? Yeah. Thank you very much. So with this, we'll end the first round. Now I will invite the second round presenter, Abisse from Côte d'Ivoire. So kindly come to the podium and you will tell us your topic, and you can use your time. Over to you.
Mesdames et Messieurs, bonjour. Je me nomme
Ladies and gentlemen, I am Dr. Charles Abulu. I'm a doctor from Ivory Coast, Côte d'Ivoire. I'll be making a presentation on mass food poisoning in Bondoku, Côte d'Ivoire, January 2023. The mass food poisoning is a concern for public health and call for health response. For January, we had 10 incidents of massive food poisoning with 146 cases. We had 131% of cases. 30th January 2023, the Regional Health Center for Bondoko indicated at the Regional Health Directorate cases of food poisoning that called for investigation by a rapid intervention group in order to describe the social demographic characteristics of the cases and identify the cause factors and recommend the way forward. In order to meet these objectives, we used the following methodology. We carried a cross-section descriptive study covering the period of 28th January to early February. And the description of cases were adapted to the provided criteria, and data was collected through data collection sheets on medical records at the various health centers where the patients were admitted. We also took samples for blood. We also analyzed this through AP4, and we got to the following results. We need to say 10 people were of identical families, and they presented abdominal issues. Dehydration, fever, and diarrhea represented 50% of the symptoms in the cases. We also had abdominal pains that were in 100%. We had 32 as the average age from 13 to 47 years. The duration of the pain was 2 days. In all the cases that we investigated, they came from the same area. The stool assessment manifested E. coli, and we had the family father who was a man of 47 years, and we had a fatality of 25%. This graph shows us the social demographic characteristics of the cases. This graph shows the various signs that we picked from the sample. And here, this table shows the deadlines or the periods for admission from detection at the hospitals. We tried to describe the residence or the habitation of the various persons that were affected. We can conclude that no source of contamination was found in spite of the samples being collected, but we were not able to get food remains because patients were admitted after 48 hours after the detection of the case. We feel that the confirmation of E. coli would be the source of the food poisoning. We put forward some recommendations targeting health service providers and various heads of district and regional hospitals. We asked them to urgently admit and check cases of massive food poisoning according to the protocols established, and also do internal supervision and trainings within health centers. Various public health actions, including admission of all the cases in hospitals and sensitization done at the community level on the various hygienic conditions and good conservation of food and related products. We wish to end our presentation by thanking the Ministry of Health and for diseases in Ivory Coast, CDC, TPA, and others. Thank you very much.
Let me call the second presenter, Sarah Elite. If Sarah is around, from Uganda. Do we have? Is Sarah around? Sarah Elite. So on topic improving HIV oral pre-exposure prophylaxis initiation. But if she's not around, let me invite Fatia Ahmed from Yemen. So if we don't have the two presenters, we'll go ahead to our question and answer session. And you can raise your question for Dr. Abise Charles Abullo. So may I ask you, is for question, yeah? So may I ask Doctor to come to the front, and I will give the chance to. Now I will give the floor first, Patrick. Number 2, number 3, number 4. Is there any other question? Okay, let's see the first 4 questions, and we'll decide later.
Ok, merci beaucoup de la brillante présentation. Alors, je juste...
Enlightening presentation. Just 2 quick ones. Did you say the incubation period is for 48 hours? Is it the incubation period that was 48 hours, or is it that they are the patients who came to hospitals 48 hours after the first signs of infection? And then what happened to the 6 others, because your infection rate did not cover those ones. What happened to the other 6 that are not covered in your caption? I'm Guyagi from Mali. Thank you very much for that presentation. You answered 2 of my questions, but I just have to make an observation regarding your study. Because when I look at your study, we have a lot of cases of food poisoning. You did a descriptive study. Wouldn't it be better to even look at a retrospective study to better delve into this problem and propose better public health actions? I was expecting that if you manage to do that, that will really help in reducing the high number of toxins, infection by toxins in food. Good morning. I'm Diallo Boubacar from CDC Guinea. I noted that the person who died was an adult of 40 years in a family where we had children who are more vulnerable than that person, than the victim. Were you interested in the cause of the death of the victim?
Thank you very much, Dr. Charles. Andrew. My first concern, well, it's a concern which has already been expressed. I feel a study of such nature would have been better if you would have enrolled control to do a comparison. But nevertheless, you decided to do a descriptive analysis. But then I want to know what actually limits you from identifying the source of infection. Thank you.
Merci beaucoup.
Thank you very much for the keenness you've shown in this study. The first question was on the incubation period. Allow me to say that it's 48 hours after when the patients manifested the first signs. That is, once they showed the signs, they went to the hospitals 48 hours thereafter. What about the 6 other patients? We need to say we took 10 patients that took a family meal, which was yam with pepper and beef stew. The food was meant for somebody who had delivered, who had been hospitalized at the Buduku Hospital, referral hospital. So after that, the food remained, and it stayed at the hospital for 6 hours before it was consumed. The Bunduku hospital is not septic. It's fairly clean, and the food stayed for 6 hours. Normally, this food needed to be disposed after 6 hours, because in Ivory Coast, yam and meat eaten 6 hours after preparation can bring challenges. So the members of the family that consumed the food had nothing to eat, as was the case. So the lady wanted to dispose the food, but this family requested that they be allowed to take that food and eat it. So that is how they got to eat it. I will now answer the question why the father died. In the Kolongo culture, these are people from the northeastern part of Ivory Coast. The father of the family is the first one to eat. After the father has eaten, then the food is given to the children. Women really love their husbands, and they watch them as they eat. So the man consumed more of the food than the rest of the members of the family. He first of all ate all the meat. He ate almost everything, and that is why we thought that is what led to his death. Sorry, I think he was greedy, if I may say. What about the 6 others? We need to say that the 6 others, the other 6 people that we met, were the people who ate the food when immediately the food had been prepared. That is 6 hours before. 6 hours they had consumed the food. So immediately it was served, they ate the food, and they didn't show any sign of infection. But those who ate the food 6 hours after the food had been given out from the hospital in Bunduku are the ones who manifested the various symptoms. The father died because, as I mentioned, he had eaten most of the food, as it were. Perhaps 2 groups that would do a comparative study. We tried, but we had rumors. And this study was done hurriedly because people were saying that the lady who prepared the food had come to poison the husband of the other person. And that was about to bring a lot of tensions in the town. So we quickly put together this study in order to preempt those rumors and give reliable reports to the various religious and administrative authorities so that we could tame the situation. Because the man who died was an influential member of an evangelical church in the region. I hope to have exhausted the questions that were assigned to me. Thank you. I hope so. Thank you once again.
Thank you very much for your presentation. presentation and also for the response. So with this, we are come to the end of our presentation, but I have one announcement. Kindly scan those barcodes to evaluate the workshop, each workshop, so that you will get the certificate at the end of the day. Unless you assess each workshop, you may not get the certificate of participation at the end of the workshop. So I will ask you to, all of you, to scan and evaluate the workshop. So I would like to thank also our moderators, Maria and Mamadou. Thank you very much. With this, we need to give him a round of applause for our last presenter. Thank you very much. Yeah. So for the interest of time, we do have a plenary session in the main auditorium. So probably after tea break, we can go directly to the plenary. Thank you.
Yango yote inamalizika, ndiye nitalala na nani? We unaenda, ndiye paka ni mawazo, ndiye paka ni kuwaza. We unaenda, naenda kama ile njia ya kuenda, kama ni maisha ya kufata. We dada, rwelo, 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 think that's the way. Rwelo, 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 think that's the way. Leo paka ni mawazo, hapo nani ya chango. Kama we unaenda, we unaenda, we unaenda. Rwelo, 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 think that's the way. Rwelo,
Today I will moderate this session. So with in order to use our time efficiently, we have passed 5 minutes. I will call, if the moderators are ready, I will call the first presenter to come and present his abstract, is Musa Luamba. We'll give you strictly 10 minutes, 5 minutes, sorry.
Si vous pouvez vraiment mettre sur le diapo,